ready, let's talk about inappropriate sinus tachycardia. Esther's Joy 7070 posted a comment asking if I would take a look at what the research says about utilizing vagus nerve stimulation to address inappropriate sinus tachycardia. Now, inappropriate sinus tachycardia is a cardiovascular autonomic dysfunction condition, which is the same thing that POTS is considered to be. And there's lots of research, as you've seen in my other videos, on using vagus nerve stimulation for POTS, but there's only this research article that I found is the first one where they've looked at utilizing vagus nerve stimulation to address inappropriate sinus tachycardia. And what happens when you have this condition, this mainly affects young women, and what happens is that the resting sinus heart rate is quite high, like over 100 beats per minute. And people experience palpitations, dizziness, and syncope, sometimes loss of consciousness. And so in this case report, there was a 30-year-old female who had the tachycardia with dizziness and sudden loss of consciousness. And she had had minimum improvement thus far with taking beta blockers. They performed twice a day non-invasive vagus nerve stimulation, so transcutaneously versus the invasive form, which is the surgically implanted device, right? And they did this at the cervical vagus nerve, so here at the neck. And they performed this for 2 months. And at the end of the 2 months, the individual had almost complete resolution of her symptoms. So she no longer had the dizziness, no longer experienced loss of consciousness, and essentially the tachycardia was pretty much gone. So that was a pretty cool case report. Another study that I looked at was with canine subjects. So they're looking at dogs. And this was looking at a little more like in-depth underneath, like what is happening when you stimulate the vagus nerve that would help with the sinus tachycardia. And what they found was they had 8 dogs in each group, 8 dogs in the group that had the true vagus nerve stimulation and 8 in the group that had the sham. And in the group that had the true vagus nerve stimulation, what they found was that it was suppression of the activity at the right stellate ganglion, which is a cluster of nerves that increases the heart rate when as part of the body's sympathetic nervous system response. So what they found is that when they stimulated the vagus nerve, it was a decrease in the activity in that right stellate ganglion that resulted in the improvement in the inappropriate sinus tachycardia. So a couple of really interesting articles again. Looks like something, that they will continue to do research on, but definitely looks promising based on what they've seen thus far. So, and if you're looking for a structured way to begin vagus nerve stimulation, safely, my recovery course walks you through it step by step. So I will link a description to that a link to that in the description for this video. So thank you so much for being here. My name is Carissa Conrad. I'm a doctor of physical therapy and therapeutic pain specialist, and I am the Vagus Nerve PT.